Member for Esquimalt Railroads.
Thank you very much, Honourable Speaker, I'll try and keep my questions brief. I wanted to talk about a constituent of mine. The Minister, I hope, is aware of this story. A letter was sent to him. Debbie Waldron is a parent who's been through quite an ordeal. Her daughter, Nicole Waldron, died in the emergency ward at St. Paul's. This may ring a bell for the Minister. Debbie was not notified of her daughter's death until many days later, when she received a call from the coroner and was asked to come and identify the body. The coroner's report into Nicole's death found that she had suffered a seizure while in the waiting area of the emergency room department, and staff had not realized that she had died until several hours later. It's a bit of a horror story, certainly. The coroner writes, and I quote, "This case highlights a potential gap in service for those patients who have been stabilized in the emergency department, but who may require further supervision." The coroner also says that following Ms. Waldron's death, a breakdown in communication occurred. It is standard practice for social workers to contact the police to assist with notification of the next of kin in the event that the hospital efforts fail. This practice was not adhered to. There is no documentation that the task was passed on to other shifts or that initial attempts were made to contact the family were made. This delay in notification resulted in significant psychological stress for Ms. Waldron's parents, as you can well imagine. A letter was sent to the Minister November 5th, 2015, and was responded to, I'm not sure this, December 11th, 2015, by Doug Hughes, Assistant Deputy Minister, in responding to this. The letter from the Director, or that was the Director of Risk Management for Providence Healthcare, wrote to Debbie Waldron, the parent, in November. I don't believe that is the letter I was referring to. I think that was subsequent. A letter from the Director of Risk Management at Providence Healthcare, St. Paul's Hospital, wrote to the parents. The Director wrote that an action plan to address deficiencies identified in a review of Nicole's death had been implemented, but he also wrote, and I quote here from his letter, "We do not believe these changes represent a solution. Without a new hospital, probably 10 years away or more, more beds, or increased community resources, we were unable to identify any change that would allow us to reliably say this could not happen again." So my constituent is, of course, extremely distressed by the series of events, by the fact that she was notified of her daughter's death only when the coroner asked her to identify the body. And then, of course, upon investigating and asking some questions, she discovered that her daughter had died in, very disturbing circumstances, left in the waiting room department, or the emergency room waiting room, for several hours before her body was discovered. So I'm hoping that the Minister could give me some message to take back to the Waldron family about this. They are, at this point, the time frame, they've received no apology for the circumstances around their daughter's death. There are still some personal items of their daughters that have been lost or mislocated during that episode that they have not been able to recover, including a purse that contained the last mementos or personal information or identification of their daughter. And so I want to ask the Minister a couple of things. If he's aware of the case, what may, if anything, he may be able to do to make sure this doesn't happen again, some kind of assurance on that. And really, I guess, what is being done to address some of the deficiencies identified by the coroner in the process that took place. I'm happy to turn all of these letters over to the Minister if he doesn't have them in his possession, but having met with the family many times, they are under a great deal of stress. The mother it's changed their lives, the circumstances around this. Certainly their daughter suffered from a number of challenges, lived on the downtown east side. But just the whole manner of her passing, of her death, and the way that they discovered it, and kind of the loose ends that they've been left at since then. And I'm hoping perhaps the minister would take it upon himself, at the very least, to perhaps reach out to the family to apologize, but maybe to look at how the procedures at St. Paul's occurred. And the coroner has identified a whole number of procedures that were really lacking, and just a breakdown in the system altogether. So I've got 2 other short questions after that, but I'm hoping the minister might be able to make comment.
Minister.
Thank you, Honourable Chair. Through to the member, well, I just can't imagine what the family is dealing with to lose their daughter that way, in any way. But I am aware, have been made aware of the situation, and I understand that Ms. Waldron wrote to the Premier, and my ADM, Doug Hughes, responded on behalf of the Premier and me. And at that point in time, the coroner's service had not concluded the investigation, so I do not have the coroner's report. In these sorts of situations, of course, well, first of all, everyone knows that the healthcare system is confronted every day with situations in which people are very much at risk, and the healthcare providers do their very best, but they're not machines, and sometimes things happen that we obviously wish did not happen, that we want to ensure, if it is preventable, that it is prevented in the future. But we need information, and while I can, as a father of 3 daughters, I certainly can understand how the parents feel. We need to get information to know how to prevent it from happening again. So we will await the coroner's report. We will examine the coroner's report. We will also, we've encouraged Ms. Waldron to contact the Patient Care Quality Review, or the Patient Care Quality Office. All health authorities have these in place, and it was this government that put those in place so that when something happens and a patient feels, or a family feels that care was not adequate, that a review be conducted, and that we fully understand what happened. We even have Section 51 investigations that allow us to fully understand the situations. Once we have that information, we can make recommendations and changes that hopefully will prevent a similar thing from happening. So I will commit that we will follow up with the Patient Care Quality Office, with the coroner, and determine, if we can, the facts of the situation, and provide some comfort to the family that if in fact there are changes that can be made to prevent this from happening to someone else's daughter, that we will.